Okay, Ms. Roussel.
Thank you, Mr. Chair. My name is Josette Roussel, and I'm a registered nurse and senior nurse advisor for the Canadian Nurses Association, the national professional voice representing nearly 139,000 RNs and nurse practitioners, including almost 1,400 nurses with specialty certification in hospice palliative care. Nurses are leaders with a fundamental role in developing and implementing a palliative approach to care. As such, I'm pleased to inform the committee that CNA is supportive of this important bill. I will now turn into CNA's 4 suggestions, including several amendments for the committee's consideration. These are outlined in detail in the brief that we will submit to the committee. First, the need for greater emphasis on a palliative approach to care through the bill. CNA advocates for a palliative approach to care enabled by advanced care planning. This approach is guided by core tenets of palliative care, such as dignity, hope, comfort, quality of life, and relief of suffering. This care is provided earlier in the course of the illness, in all health settings, by a range of healthcare professionals, and involves physical, psychological, social, and spiritual care. CNA believes that the proposed bill must speak to the palliative approach to care, as opposed to limiting the discussion to specific service provided in the patient's final days. We therefore recommend that Clause A under Section 2-1 be as follows, quote, defines what palliative care in a palliative approach to care is. Secondly, we suggest expanding palliative care training and education beyond specialized palliative care providers. Research reveals our country does not have adequate palliative care training for healthcare providers. One way to address this gap would be to include education and training into the core curricula for students in all healthcare disciplines. We therefore recommend that Clause B be amended as follows, quote, identifies the palliative care training and education needs of palliative care healthcare providers as well as other healthcare providers. Thirdly, CNA encourages the committee to support the development and implementation of national evidence-based standards for integrated palliative care. Currently, there are no nationwide policies and evidence-based standards of care to ensure integration of the palliative approach to care across the continuum. In addition to not having a framework for palliative care, there are no standardized and widely adopted method to guide healthcare providers, including nurses, on when and how to implement a palliative approach to care. The lack of national evidence-based standards for integrated palliative care renders it impossible to collect relevant data and track and report on key indicators. Therefore, the provinces and territories have limited capability to understand whether, where, and how to improve palliative care. Therefore, CNA recommends Clause D be amended as follows, quote, collects standards from research and data on palliative care. Finally, I'd like to address the provision of funding to develop a framework for palliative care in Canada. CNA supports the recommendations outlined in the 2015 Quality End-of-Life Care Coalition of Canada report titled The Way Forward. The coalition calls for federal funding for establishment of a national secretariat that would oversee development, implementation, and maintenance of a national palliative care framework. This would set strategic directions and lead a coordinated, comprehensive, pan-Canadian approach to palliative care. Reinstatement of the Health Canada Secretariat of Palliative End-of-Life Care is a move that CNA would support. In closing, I emphasize that CNA is a strong advocate for high-quality palliative care that is accessible to all Canadians in settings that best suit their care needs. I would like to thank the committee for providing CNA with the opportunity to speak on behalf of RNs and NPs in Canada on this important matter, and I look forward to your questions.
We'd like to thank you both for coming.